Hello. Thanks for attending or being on this live stream today. This is our just periodic general update. There's a lot of things that's happened since the last time. And so based on a lot of questions that have been coming in, I've invited some people here who may be better able to answer your questions. We have the Director of Public Safety. We have the Director of Human Resources, the Interim Director of Health, Chief of Development, and we also have the Police Chief. And so we'll just, if you don't mind, I'll just skip any statement and just go straight to whatever questions that you want to have. I know that some have already sent some in, so we're going to alternate between the ones that have been sent in already, and then we'll be looking at the others that are online and answering those, and I'll respond if I can. If I cannot, then I will have the person who can give you the proper answer come and respond for it. Okay? All right, the first question.
I'm curious about why the health department has been moved under the Office of Prevention, Intervention, and Opportunities for Youth and Young Adults. I've been doing some research on other local health departments, and I cannot find another department structured in this way.
I don't know if you heard the question, but the question was, why did we move the health department under our youth programming, youth intervention programming, and that in the reporters' research, they have not found any other health department that is structured that way. And the reason is very simple for me, and that is that we live in a different time, and traditional modes of health care delivery and the way in which health departments function are not necessarily applicable for the time that we're living in. As you know, Chief Tracy Martin Thompson is head of our youth intervention and program, and deals with a lot of trauma out on the street with young people. And as you also know, with the social unrest, there's been identification of racism as a public health issue, and the impact of racism on the economic and social fabric of certain communities, and how that is resulted in toxic stress in a social way that is completely in line with what Chief Martin is doing. So we want to, as we restructure the health department and look at the health department and see, as we evaluate the current situations there and made some recommendation on change of leadership, we want to now begin to not only change the leadership, but change that leadership and the culture and the direction in line with what is needed today. And that is why we're doing that.
Also, now that the department has been restructured, will the city report its COVID numbers under the Cuyahoga County Health Poorest data, or will they continue to be separate? And
the question is, now that we're restructuring, are we reporting collapsing our data into the county health board, or are we reporting separately? And we're going to continue to report the way we're reporting.
Next question is from Ronnie Duncan from 19. Mayor Jackson, are you satisfied with how Cleveland in total has responded to the public health crisis of COVID-19, despite some differences with the state's approach? And second, do you have any mandates or concerns about moving forward?
The question is, are we satisfied with health department's response and handling of the pandemic? And then secondly, do we have any new mandates? We will only be satisfied with our performance when there is zero infections and that we have this pandemic under control. I am, however, pleased with the work that the health department has done thus far. Example is we've gone from an average of 7-day average, probably up in the 70s or 80s when we were having some days where there were over 100 new infections, to now our 7-day average is probably 20 or below. So there's significant efforts put into this, and we can see the outcome of those efforts. So they are doing a pretty good job of staying on top of the pandemic. One of the reasons why interim director Kimball is picked is because he's been intricately involved in the whole pandemic effort. And so we want to keep that on track as we deal with other restructuring things and other concerns that we have in the health department. And in terms of new mandates, we'll play that by ear. As you know, there was a football game this evening, and one of I think the last mandate we had was around no tailgating. And so we kind of play that by ear and determine what we need to do on a moment's notice.
Okay, Mayor. Next questions deal with the IX Center. There are several.
Well, before you ask a question, this question is for the IX Center. So I'm gonna let Chief Ripka respond to that, and if I need to add anything, then I'll come back up and add it. Chief.
So group the questions together. We know that the IX Center, we heard that the IX Center may be closing as the Park Corporation communicated with the city about the potential closure. And could you also talk about what the impact of the facility shutting down means for the city of Cleveland in terms of its lease and revenue to the city?
The IX Center Corporation notified the city of Cleveland yesterday that it was taking action to permanently close their business, that they would be just winding down their affairs over the next months. The impact on the city, and again, keep in mind that the IX Center is owned by the city of Cleveland and specifically by the Department of Port Control, and therefore the lost revenue that we gain from the annual lease payments that the IX Center Corporation makes to the city, which is over $2 million a year, will be a financial burden that the airport needs to deal with. And then obviously the loss of jobs. There are 75 jobs that'll those employees will still be paid through November 15th, full payment with benefits, but once they lose their jobs, there'll be a loss of payroll tax and income to the city of Cleveland.
All right, and also I want to say to you that Mr. Park has run a very good operation, and his the IX Center has been a very significant asset for the city of Cleveland, and the loss of that operation, we're going to feel it not only in terms of the revenues that the chief talked about, but also in future activities going forward. We will, however, be looking at what is the highest and best use of the facility as we move forward, and want to again really commend Mr. Park for his operation, but just like many things, this pandemic has really hurt a lot of people and a lot of businesses, whether small or large, and the fact that he could not put on any shows. It's hard to carry costs with zero revenue. And so that's just part of the negative impact of this pandemic.
Okay. Now we're going to move to safety.
All right, go ahead and ask the question.
Okay. First question is from a Nancy Pickering. Do you accept responsibility to the jump in the crime numbers in the city of Cleveland?
Well, I'm the mayor. I accept responsibility for everything that happens directly or indirectly, whether or not I have direct control over it or indirect control over it, or just side control over it. So I'm the mayor. So if you as old folks say, you pay the cost to be the boss. And that means that I have to accept the responsibility of failures, and I have to also accept the challenges associated with correcting those things that are occurring that are not good for the city of Cleveland, whether it's social or economic. And I imagine in you asking that question and being a fair person when you ask, you would also give the mayor credit for those things that we have accomplished.
Which leads to the next question. Mayor, this is from Adonna Ritchie.
Mhm.
How safe are your streets? Are there demonstrations, and what efforts are you taking to keep citizens and police safe?
Well, me taking is what actions am I taking to keep police and citizens safe in our demonstrations? There are demonstrations all the time. They happen in front of my house. I've had 3 of them in the last 6 weeks. So they happen in front of my house, and I'm assuming that you might be referring to the upcoming debate where we know there will be demonstrations, and so we're planning on that. And I'll let Chief respond to that.
Thanks, Mayor. I think the mayor hit the nail on the head. There are demonstrations that happen here in the city on a weekly basis, several sometimes during the weekend. And the Division of Police, along with our other partners, man those demonstrations. And a lot of folks have probably seen things happen out there on the streets. We don't let things get out of hand. There is a plan that's developed for each demonstration that happens. And, you know, so far, we've been able to make sure that things go as promised, that people exercise their constitutional rights in a safe way, in a peaceful way, and that our neighborhoods and our districts that have these demonstrations are taken care of. As it relates to crime, as the mayor said, I'm the chief of the city of Cleveland, and I take full responsibility for anything that happens related to crime in the city. And I know that the men and women of our police division work hard day in and day out. And as people know, on occasion, even give their lives to make sure our city's safe and to do everything they can in that regard. So we take it seriously. We do everything possible to maintain safety in the city, but it is a collective effort between the Division of Police, our other safety partners, and our citizens in this city to keep the city safe.
Okay.
We have a couple questions going back to the Department of Health.
Mhm.
Scott Knoll is asking if you can describe your reactions to the findings that came out around the Department of Health, and can you summarize those findings?
Well, we get many complaints, not just the Department of Health, but throughout the city for various reasons. And so when those findings come out, we take them serious. And so and when this last finding came out in regards to the health department is one of the reasons why we wanted to do a thorough investigation, not just on that issue of that finding, which was a reversal from the original finding, but we want to look at other aspects that may have helped led to whatever complaints that were occurring. But I'll let the Director of Human Resources talk about the process, talk about the finding, talk about the reversal of that finding, and the concentrated effort that her team did to reinstitute a new investigation based on that reversal. Director.
Thank you, Mayor. As the mayor said, there was an investigation that was led. We looked into 4 items in specific. The first item was the reopening of an investigation that was conducted in Human Resources. The second was the loss of the STI HIV grant. The third was looking at hiring and vacancies within CDPH. And the fourth was employee morale and the culture. Out of those 4 areas, we came to recommendations with regard to the reorganization of the Department of Public Health. We developed a strategic plan with regard to reviewing vacancies and the hiring of employees within CDPH. There will be a task force that's brought together to review all of those vacancies and hiring on a continual basis. We will also look into how the department is reviewed with regard to their grants. The grants will be reviewed by partners within Human Resources, the Office of Finance, the Department of Health, and the Office of the Mayor. Those will be reviewed on a routine basis to ensure all grant recommendations and requirements are met and that we're strategic and proactive in those efforts. We will also have a group that reviews the culture and morale of the CDPH department. That will be an ongoing and continuous review. And last was the EEO complaint. That was an internal complaint. This internal complaint was initially done by my office. We rescinded that recommendation in its entirety, and we replaced the recommendation that we provided to the mayor in its place. That recommendation that we provided to the mayor is the complete and final report that has replaced the original complaint recommendation that was provided.
Back to the airport, there are a couple of questions. One from Michelle Jarbo from Cranes, Cleveland. What is the status of the IX Center Corp's lease agreement with the city, and when does the current lease end? And what obligations does the IX Center Corp still have to the city under that lease?
Chief?
The IX Center lease option, the current option expires at the end of August of 2024. There's actually then other options that the IX Center Corporation had a legal right to exercise. So their interest in the building was still another 19 years in the of the operation. In terms of the current lease, though, it's still a lease that's in effect with the city of Cleveland. Options that we are looking at, and but also recognizing that there's probably a need for us to work to identify a future operator and tenant for that.
And staying with the airport, Brandon Simmons from KYC had a couple of questions. The first one is, could the county be involved in future operations of the IX Center? He also asked, what is the city's financial liability when it comes to the property, and how might the airport be affected since this part of the deal for airport space is managed by Port Control?
The question regards to the county was what?
Could the county be involved in the future operations of the IX Center?
Well, we don't know. We own the building, and we will do whatever is best with that building that has the most positive impact on the city of Cleveland. What arrangements will be made for that is to be determined. Right now, we're looking at how do we handle immediacy of this problem that we have with Ag Center being non-operating, and then what are our options in order to have the best utilization of the building. How that is done and who we partnership with will be my decision. But the other questions?
The City of Cleveland Department of Port Control is the owner of the real estate. Therefore, we have a responsibility for the property. We would be looking to either continue and assume the insurance policies that the IX Corporation has for that property, or looking to get our own insurance to cover that building. But there are definitely liabilities that the city will assume, and that includes paying the real estate taxes, which are about $800,000 a year.
Bob Hicks from Cleveland.com, staying with the IX Center. Will you find a new vendor to run the IX Center? One of the people who spoke to Cleveland.com said that you had offered assurances that the center will continue operating.
I'd like to know who Bob talked to in terms of us offering assurance that the IX Center will continue to operate. We cannot ensure that the IX Center will continue to operate in the way in which it's been operating. But what we can ensure is that we will do our due diligence to find out what is the highest and best use that is of the greatest benefit to the city of Cleveland. So I don't know who they talk to in that regard.
We have several more questions for the health department.
What is that?
Group those back together. Bob Higgs, the report for the investigation into the Department of Health says that there were several areas of concerns indicating negligence which must be immediately addressed. Could you elaborate? And what happens now to correct those management issues?
Well, the question is, the report, I guess, mentioned negligence, and he wants to know what those negligence acts were, I guess. And then what was the last part?
And could you elaborate on that? And then what happens now to correct those management?
And in terms of correcting management, that what happened now is exactly what we've done. We have had pre-dis, we had to move people out of positions. We're putting interim people in place. We'll put in some permanent people. We will evaluate where we are now and where we want to go in the future. And we'll post jobs and to have those job descriptions match our new culture and new direction that we want to proceed in. But the negligence stuff, I don't know correctly.
Mayor, as the report detailed, there was an example with regard to the assignment of work for critical, essential, and non-essential staff. So there was one example that was actually contained within the report where we provided a narrative of what we felt was one example of mismanagement. As there are still some investigations that are currently ongoing, we can't get into specifics about all of those areas. However, once those disciplinary hearings and once the investigations at the federal level are completed, there could be more information provided on those specifics. But at this time, because there are pre-disciplinary hearings going on and there's still the federal investigation, we can't get into specifics of the mismanagement and the negligence.
Moving again, on staying on with the Department of Health, Rachel DeSale has several questions. So we're going to try to summarize some of these. The first one is, did the city hire outside counsel to handle any of the discrimination or retaliation complaints against members of its leadership? If so, what has the cost been to the taxpayer?
Did we hire outside counsel?
There was one, prior to this, there was one investigation that we did hire an outside counsel, Attorney Diane Citrino. That report was made public. That was between a contract between the law department and outside counsel, so I'm not sure of the cost of that specific engagement, but that is the only time I recall being engaged with outside counsel.
The next question is, the Ohio Civil Rights Commission found probable cause that Karen Aluma, a Colombian-born epidemiologist, was discriminated against. The city found that there was no discrimination. What's the difference?
The Ohio Civil Rights Commission is going through an investigatory process. I cannot speak for the Ohio Civil Rights Commission. However, when our investigatory team reviewed this, we looked at the definitions as prescribed by the EEOC. When we reviewed all of the information that we provided, and after we spoke to several individuals within the Department of Health, as we stated in the report, that we did not see specific race-based allegations. We saw mistreatment of all employees, regardless of race. So that is how the investigatory team came to our decision, because we, as the report states, saw treatment of employees of all races were mistreated or treated in an inappropriate manner.
Okay, again, Rachel DeSale, will the city fight a civil rights charge in that case?
The city will take a position, whatever is in the best interest of the city of Cleveland. And so if we decide it's in the best interest of the city of Cleveland to fight that decision or to mediate on that decision, then that's what we'll do. But we'll do whatever's in the best interest of the city.
Again, Rachel DeSale, if there was no problem with discrimination in the department and the investigation found all employees were treated unfairly, then why are a dissent portion of the fixes employees related to discrimination, race, and anti-bias training?
if, I'll let the director ask, but I think one of the findings that, agency had is that, we should do some things. And so those things that they recommended are not onerous and things that probably should happen. So we didn't find any problem with instituting that director.
Mayor, that's correct. We found no apparent violation of any discriminatory behavior. As an organization, we understand the importance of continual education on diversity, equity, justice, and inclusion. With any department where there are allegations of this type of behavior, it is important that we train and educate and continually have professional development in these areas. We understand, as the report said, that diversity and equity inclusion experts say that all human beings have implicit bias. So it is improper of us to not understand those theoretical and disciplinary matters and not take some responsible action in order to ensure everyone in the department is aware of what those biases may be and make sure that we're training our leaders and staff to recognize those and account for them in an appropriate manner.
Okay. Again, Rachel DeSalle. Does the mayor think the reports by multiple employees of discrimination in a toxic environment were inaccurate?
What the mayor thinks is not really relevant in terms of the outcome. What the facts are, what the facts are. I accept the facts. We conducted a thorough investigation, and that was presented to me, I think Friday. And then, and I accept the facts of it. But what I think is irrelevant because I was not there, not part of that operation. So it's whatever the facts are, they are.
Anna Huntsman from IdeaStream has two questions. One, she'd like to ask Interim Director Brian Kimball about what's next for the health department now that the roles have been restructured, and what is his priorities and plans for the department as interim director. And to summarize, she also asked, what are the biggest priorities for health moving forward?
Well, those are the things that I would be, in terms of what the priority the health department is going forward, and those are the things that I will be discussing with the interim director. And so those are things that after he and I discuss those things, then we'll move forward. I will get his input, and then we will match his input with the current immediacy of what the health department needs to do in terms of pandemic, but also restructuring and positioning the health department for the future in regards to trauma, toxic environments, racism as a public health, violence as a public health, and really populating the health department with personnel and job descriptions that will accomplish that. But those are things that the director and I will be discussing.
Going to safety, Scott Knoll, News 5, what concrete plans have been put in place to reduce violent crime in the city? Several weeks into Operation Legend, it appears that homicides are still a great deal higher than they have been in recent years.
Chief, you got that?
Well, that's a great question. That's a question that I really can't give you details on. What I can tell you is that we do have concrete plans in place to address violence in the city and other crimes in the city. And we do it in partnership from the federal level on down to the county, state, and local level. A lot of the violent crime that happens in the city happens as retaliatory things. That's why our folks try to make sure that the intelligence we receive, we act on as quick as possible. When shootings happen, like the ones that happened last night, we really start to look at the folks around that incident itself and who that particular group or individuals may have had problems with in the past, to look for that retaliatory part of what happens in violent crime. But there are concrete plans in place, and I just can't tell you what those plans are in detail right now.
And if I may add to what the chief said, the immediacy of your question around violent crime or crime in general and the need for concrete plans is the immediate question of today. But that is one of the reasons why we are looking to restructure and redirect the health department in a way that it helps assist in the prevention side, because the underlying issues that result in that type of behavior are the things that we have to address. Now, we are living in a time where there's a lot of anxieties going on across the country for various reasons, whether it be for criminal activity, political activity, social unrest around social issues, all these things. So we live in a very agitated time, and it appears that crime and the uptick in crime has really become part of that whole mood that is permeating the country now, and particularly our urban centers. But it's also happening, we're finding in rural areas, in areas where it traditionally had not happened before. And you can tie drugs into that, you can tie in toxic stress, toxic environments, the traumatization of people, the lack of all these kinds of things that are not police things where they can develop a concrete plan because they're enforcement. So we have to continue to work on those concrete plans that deal with the prevention side, and to take away some of the reasons for making those kinds of bad decisions in regards to crime.
Mark Namick has a question. Can you speak to if there are any permits or requests for demonstrations and/or marches received by the city of Cleveland for the date of the debate, which is less than 2 weeks away?
I don't know of any, but I imagine that we can find out. I don't know of any, but what Mark asked was, can I speak to whether or not there's been permits requested or issued for the debate for demonstrations? And I don't know of any as of today, but that's not surprising to me, because the people who we're expecting to demonstrate wouldn't ask for the permits anyway. The ones who usually ask for permits are the ones who follow the rules and usually are very small in nature and very peaceful in nature. But we're anticipating people going to demonstrate whether they got a permit or not. It doesn't matter. So we're just preparing for that. But I'm not aware of any being asked for or granted at this time.
Okay. David Higgins asked 2 questions.
Y'all busy today.
Yeah, what are we doing? What are we gonna do to fix the crumbling infrastructure and the deteriorating neighborhoods on the east and the west sides? And he went on to say, my mother lives on the near west side, doesn't go out after the sun goes down. What are we doing to make our citizens that follow the law and pay their taxes feel safe?
Well, again, the question is, his mother lives on the near west side, and she doesn't go out at the dark. So what are we doing to make his mother and citizens feel safe? I think the chief and I have attempted to address that, and that we're looking at the immediacy of enforcement plus dealing with long-term things around prevention. The other question that he had was about crumbling infrastructure. I don't know exactly what he means by crumbling infrastructure. I know that we invest about $12 million a year in residential street resurfacing over the last 3 to 4 years. And then we have additional millions of dollars that come in annually for major issue 1 streets where they're state roads, and we participate with a percentage of that cost. And in that, you have sidewalks repaired, curbs, and along the street resurfacing, and we do the water lines, the sewer lines, or whatever it is that need to be done. When we have that state operation under the street resurfacing side, we go in and we grind out the old asphalt, we put new asphalt on. We then, if there's a tree damaged sidewalk, We then repair that tree damaged sidewalk, and we're also incorporating into that systematically the pruning of trees, particularly those, and looking at dead or trees that are created danger in terms of power lines and things like that. If you're looking at potholes, they fill them constantly on those streets that need them, as long as the weather is okay. So I've already addressed utilities and streets and those opportunities when sidewalks are available and when they're not, and then tree damaged sidewalks. So not knowing specifically what crumbling infrastructure you're talking about, I'm not able to answer it specifically, but that's a general kind of notion. If you're more specific, then I can deal with that.
And David Higgins, one more question. What plans are in place to combat rampant crime and violence throughout the city?
Well, again, we've answered that question in terms of what the chief said and what I've said, that we partner with our federal, state, county, other local police agencies. We're currently in partnership with the federal government on Operation Legend. We do our gang task force, our drug interdiction. We do all of those things around enforcement. At the same time, we're working on those preventative things around how do we have people more included into the economic prosperity, whether through contracts or wealth creation or job opportunities. We're looking at those areas of the city where you have toxic environments, social environments, excuse me, where young people are traumatized and communities are traumatized as a result of that toxic environment. And that is, again, why we're moving the health department in that direction, along with our prevention around youth activity. So we've answered that, and I will answer it again if the question is asked again. You, Chief, you want to add something? Yes. Okay.
Well, again, I said I couldn't really get into our concrete plans about violent crime enforcement, but what I can put out there is, the need for our citizens out there to call when they see things going on, to be involved in the solution. With this pandemic going on, a lot more folks are at home. Prior to this, the majority of our folks were either away at work or school or some other kind of programming activities, things like that. So you really didn't have all of us kind of compacted together for extended periods of time during the day. We're seeing that now all over the city. We're seeing that all over the country. What we try to impress upon our folks out there in the city is to call us. If you see a particular neighborhood, particular street, group of individuals or house that's a problem, call your local district commander. You can call the Mayor's Action Center, 664-2000. You can call the Chief's Office, 623-5005. You can give us that information so our men and women out there in blue can act on that information. Our intelligence folks can take a look at the intelligence, put the pieces together to make sure we stamp out a lot of those things that are happening. But in this day and age, it's incumbent upon all of us to pitch in, especially with information on what's going on, so that law enforcement and our partners can act on it, so that the mayor's prevention folks can actually get out there and talk to kids in the neighborhoods and families to see what their needs are, so that we can get a handle on these things.
And Chief?
And one other thing I want to mention, I know that when you get down to the local level, leadership at the local level are responsible for addressing all those things that you have raised. But a lot of the challenges that is faced by local communities are the results of policies that have been established at the federal and state level. And one of those policies, and that became a legislative agenda, is the availability of guns of all fashions and kinds and all types, right? I can remember before we challenged it in the court as to, based on home rule, when it was pretty much said that anybody can carry a gun with some restrictions, and that you could carry a concealed weapon if you got the proper paperwork to do that. And I remember at one time, in order to get the proper paperwork to carry a concealed weapon, you almost had to go through OPATA, almost training, and go through some courses, and that would take some time for you to even get those licenses. Now, in a day, you can go through a little course and go to the firing range and shoot, and then you can get your license. It's just that easy. So my point in saying that is that we also had where you could not have assault rifles in the city of Cleveland. Now that's gone. So our ability to manage the availability of guns, not the restriction or saying people couldn't have them, but really to manage it in a way that is good for the city of Cleveland is completely gone. So we have to deal with that and availability of guns and the ability for people on the street to be able to get guns because someone else can buy the gun and then sell it to them. And there's a market for that, and they don't have to have any identification of who they sold it to or anything. We call them straw purchasers. So all these things are happening all at the same time. And the outcome of that is what you see. I can remember when Michael McGrath was the chief of police, and when we lost the case in the state Supreme Court that said we could not have any laws that would in any way regulate or prohibit the use of, or the carrying of guns. When we lost that case, I remember Chief McGrath then saying that he didn't know where, when, or who, but what he guaranteed is that somebody was going to die. And it was going to be a lot of somebodies. That's what he said then, and what he said then has actually come to fruition. Now, is it all about guns? No. That is why you have to have these underlying things on prevention, and that is why we have to have concentrated enforcement. And it's just like right now, I can tell you that the police can give you all kind of data about the number of guns that they confiscated, but it's like shooting fish in a barrel, so to speak. You just confiscate them, and the barrel fills back up. So there's a lot of other things going on associated. So the question to us is what we're doing what we're doing. How effective that is becomes another question. And then if it is not as effective as it should be, or we'd like it to be, then that is another question as to why not. And I've just given you what I believe to be some of the why nots.
Mayor Brandon Simmons from WKYC asked, if it hasn't been addressed already, can you comment on the latest census survey results that show Cleveland is the poorest largest city in 2019 with 30.8% of residents living below the poverty line? Are there any initiatives to help combat this?
Well, poverty is an ongoing situation. I can imagine if you talked about this 100 years ago, 200 years ago, you'd be asking the same question around poverty. And the real issue is about how do we ensure that everybody can participate in the quality of life and the prosperity that we create. And if we have policies or we have institutional behavior in place that restricts people from being able to participate in that prosperity and quality of life, you're going to have poverty. So that is why institutionalized things such as inequities, disparities, and racism are major issues that we have to address if we want to eliminate poverty, crime, and other kind of negative things that are going on socially in the United States and in Cleveland in particular. Now, what do we do locally? We have our community benefits that when we participate in and development activity, and we contribute a certain amount of money or benefit to that development, that there, in terms of contracting, there has to be a community benefits agreement that allows for full participation of all sectors of our community. We also, as you know, we had resume hiring law, Fannie Lewis law, that guaranteed 20% of all construction hours where we have participated in their development would be city residents. As you know, the state Supreme Court took that away from us too. So now we're even though we've done something to help address that, it turns around and then they take away that tool from us. So we have to then find another way to address poverty and employment in that regard. We're looking at how do we do through our OEO office, how do we have rotating contracts with smaller contractors so that they can procure goods and services from the city and allow for them to have contracts for goods and services but maintain employment. Education is a key factor, not only in terms of higher pre-K to 12th grade, but also higher education. And when I say higher education, I just don't mean a college degree, but also whatever trade or skill set you need or technical thing to get a job to fill vacancies that are in demand. All those things we are working on. But again, when you're fighting institutionalized inequities, disparities, and racism, and institutionalized things that help to keep in place poverty, is more of a challenge than just one program or one initiative. But we're doing quite a few things. Are we satisfied? No. That is why we believe that institutionalized inequities and disparities and racism is a public health issue and should be addressed if we want to address the underlying issues that result in crime and poverty, death, chronic illnesses, and all these things.
Okay, Mayor, Adrian DiPiazzi from Fox 8. What is the mayor's outlook for the future of downtown development and its economy, with hundreds of business professionals not expected to return until next year and no plan to see theaters or sports venues operating anywhere in the near future?
Well, the plan for that is that how are we going to look? The question is, I'll summarize it. What is the city's plan, or I guess my plan, to address the fact that we do not have a hospitality industry anymore, and that there are many people who are working long distance? So the whole thing around having large number of people who can participate in purchasing goods and services and going to different venues and all these other kind of things are not there. How do we intend to address that? Well, that will, in some sense, not completely, but in some sense, will resolve itself once we deal with the pandemic. There will be no economic growth. There will be no economic prosperity. There will be no new form of economic activity around hospitality until we first deal with the pandemic. There will be not. It will not be. So until we deal with this pandemic and deal with it in a way that allows people to begin to move around and return to some form of normalcy, whatever that new form is, then we will be in this same situation. Just like it's affecting businesses in terms of having to close, it is also affecting cities in terms of revenues that we will receive from those businesses, their employees, and other revenues associated with hotels and parking and admission tax and all this stuff. So it has a wide range of impact. The key here is addressing the pandemic. And as we're doing that, as it becomes more apparent that people can be freer to move around, and we have to see whatever that new reality is, I believe that Cleveland is a very competitive place and will be able to compete with anybody coming out of this pandemic in terms of hospitality and all of those related businesses. As you know, we have our healthcare industry is a mainstay, well, not in Cleveland, but the region. It is hit, but not hit as hard as hospitality. As you also know, manufacturing is something that we have. It is not as stable as it used to be, but it's not unstable. We have government and we have institutional kind of things, and we're all still working and in existence during this time. So it will happen. How it actually look, I can tell you now, but I know that Cleveland will be competitive when, in fact, this happens.
Mayor, just a few more questions.
A few more questions.
Andrew
Okay.
Donald Winter asks,
All right.
regarding the Hyperloop, the master plan,
Hyperloop.
the Hyperloop, the master plan for Cleveland Hopkins International Airport is currently taking place.
Right.
Is there any traction on including the Hyperloop into those plans for the future? What is currently the status of the assessment, and what is the city doing to position Cleveland as a viable option?
Well, they're talking about the Hyperloop, and you know, this is that high-speed transportation. I guess is in a tunnel, and I believe NOACA is a major part of that and studying. And we are, and the question is, how's the airport considering being part of this future way of transportation to connecting cities and do it in a very quick way, right? You could get from here to there very rapidly because of this Hyperloop. Well, the airport is going through a master plan. I don't know if they've incorporated this Hyperloop into their master plan. The Hyperloop is not a reality now. So I guess if they're going to include it, they have to make some consideration for it, but they couldn't do any hard development cost kind of stuff because it is not a reality yet. But it is a good question about the connection between the Hyperloop and airport. Give example how the question is so on point is that we were the first city in the country, I believe, to have an airport where we had public transportation, the rapid transit connect from downtown Cleveland and the neighborhood into the airport. So you can get on the rapid and go straight to the airport. I forget what the price is, but it's $2 and something, $3, and you can go straight to the airport and not have to worry about parking. So this is a similar kind of consideration. So I'll find out, and then I'll if we can get. You have the answer already? He's got the answer already. So.
The answer is yes, we're considering it. A major part of the master plan analysis, besides looking at things such as runways and the terminal building and the ease of the public to use our airport, is the whole regional transportation access system to and from the airport. Today, that's a difficult route to go from I-71, I-480, around 237 to get to the main entrance into the airport. And then that distance between those entrance points and the terminal drop-off and pickup are way too short, probably some of the shortest for an airport of our size in the United States. But Hyperloop would be part of that regional transportation access. And how does that make sense to link that mode of transportation with air transportation? So the answer is yes, we're looking at that.
Bob Hicks from Cleveland.com asks, will there be patrolling by CPD this evening to watch for tailgating? And will people found tailgating be subject to tickets? Is the Muni lot open for parking for limited fans that have tickets? And then are we going to patrol the bars for overcrowding?
Yes.
Yeah, and the chief has said yes to all that. But what I'll have is the director, Howard, come up and kind of repeat whatever it is, and then Angela and Chief said yes to all
Yes, as the chief stated, the answer is yes. We will have our districts going out as they have been over the past few months, doing COVID enforcement, looking at the bars, restaurants, making sure that they are following guidelines, that they have a COVID maximum occupancy, that they have require masks for their employees and for their patrons, and that they are facilitating social distancing. Police will also be patrolling city parking lots and permitted lots to ensure that there is no tailgating, so that we can continue to combat this virus and get it under control. So the answer to all that is yes.
And then Mayor, finally, Rachel Giselle.
Did you say finally?
Finally.
Oh,
We can keep going.
who's our
Well,
final
Rachel
person?
Giselle
Rachel, okay,
has a couple questions to round out on the health side.
no, okay.
She asked questions regarding, one, why isn't the physician or the medical doctor part of the leadership of the Department of Health? Why do we only have a part-time medical director? And then why was only one of 5 department epidemiologists part of the COVID-19 public health response? And then lastly, how does all the changes made to date, the recent issues, help solve the systematic issues or make Clevelanders healthy?
Well, you asked a lot of questions, but all those questions are the same questions that we're asking. So if you read the report says that we will do a diagnostic of the health department that would incorporate all of the questions that you asked to see what is the proper lineup, the proper way in which leadership is in the new direction that we're going in. So those are some of the questions that we will be answering. And as was reported in the report, one of the issues that we had with the department is that they were not, first of all, people were leaving. Why? Secondly, positions weren't getting filled. Why? And then people who were considered to be critical employees were not in person. Why? So these are reasons why we're taking action that we've taken, along with creating a new culture, a new direction for the health department. And the diagnostic side of this is key in order to help us answer those questions and to put in place a system and institutionalize a system that is the best way to function to deliver the immediate health needs to Clevelanders, as well as dealing with the long-range prevention side, because we don't want to be like a lot of medical stuff now. You just go in for the treatment. The key is how do you not have to have treatment. We don't want to be in a position where we're talking about traumatized young people. We want to deal with the trauma before they get traumatized, and then we got to deal with toxic environment. All these kind of things, and what the role of an epidemiologist is in regards to this new culture is a whole different question, as opposed to what an epidemiologist would do based on traditional healthcare models as you have today. But I know that the diagnostic is key to answering all these questions. Director, do you have something to say? Okay.
Okay. Last thing, Mayor, I know I said last thing already.
Okay.
Quick things. Andrew Winter said, thank you for your answer on the Hyperloop and the master plan at CLE Airport. I'm hoping the future is bright for our city.
Well, that was a statement, so I thank you for the statement.
And lastly, Mayor, do you want to remind people about the state of the city?
No, we're not doing that. What we're doing is, what I liked about this press conference is that you asked the questions. The thing that doesn't work too well for me or you, for the city and your industry, is when you make the assumption without asking the question, and then you ask us to respond to it after you print it or you air the assumption. So what this is, I don't mind the length of it. I don't mind the questions. Actually, we welcome the questions and welcome the challenging questions that you presented. to us, because not only are we answering it to you, but we're also, as you know, doing this format, we're talking to everyone who is listening. So again, I want to thank you for participating, and we will continue to do these brief updates, these periodic updates. Thank you very much.